Georgina with the Association of British Paediatric Nurses, and today I'm going to be talking to a children's nurse. We're going to talk all about their life and their experiences of being a children's nurse. I hope you enjoy the video.
Hi, I'm Georgina and I'm here with Mel Hayward, who's got experience being a children's nurse. So welcome.
Hello, lovely to be here.
So how long have you been a children's nurse for?
Oh, good question. So I started my nurse education in 1994. So if you include being a student nurse, what's that? 29 years, is that right? Gosh, no, is that right?
Yeah, I think that's right. Yeah,
Wow, that's amazing. There you go. A long time.
brilliant. And are you currently a children's nurse or do you work in another field?
So I am a registered children's nurse. I still am on the NMC register as a children's nurse. I am also a registered specialist community public health nurse in school nursing, as well as a registered nurse teacher and a community nurse prescriber. So I am very much a children's nurse. I still see myself as a children's nurse. That's the thing I'm most proud of my achievements in my career. But I suppose when I then explain about what I do on a day-to-day, my job, people would probably think, well, you're not a nurse, but I am a registered children's nurse. I'm still on the register. What I do currently is I work in academia. So I work in a university and I'm an associate professor of education. So my current role, even though I do still teach a little bit of children's nursing and teach community nursing, primarily my role is around ensuring the quality of our education across health and social care programs, including children's nursing, is as it should be according to what the Nursing and Midwifery Council and other professional bodies need it to be. So ensuring that our education, it is what it is in terms of making sure, if we've got high quality education, we should have high quality care out there. That's a whole thing anyway. So yes, it's a long answer.
And why did you choose children's nursing in particular?
That's a really good question. So I knew from a fairly young age I wanted to work with children. I enjoyed being with children. I enjoyed what childhood meant. Even as a child, I enjoyed the idea of what childhood is, in the sense of that so much learning and development involved, and I suppose the beauty of transferring or transitioning into being an adult and what that means. That whole part of being a child and childhood is so important because it prepares you for adulthood, and everything that you can achieve as a child, everything you become as a child is so important. So I was very aware I wanted to work with children to support that development, if that makes sense. I didn't know whether I wanted to necessarily be a children's nurse or whether I wanted to be a primary school teacher. I did think of that for a while. I did also think about medicine as well. I thought of quite a few different things. I ended up children's nursing because when I read around different career paths, that seemed to be the thing that really kind of fitted with me probably the best. I always liked biology and all those sorts of things, so it kind of made sense. So yes, that's why I ended up in children's nursing.
And what was the hardest part of the training for you?
Oh, it's a really good question. I think the hardest part of the training, and I've got to think back a few years now, was dealing with my emotions, probably. So one of the things when I did my training, because we lived in the hospitals, we lived in the nurses' home attached to the hospital. So you'd come off shift and you'd literally just walk through a couple of corridors and up the stairs and you were back into your room where you lived. So you were in the same building. And so for me, I think there was occasions where I would have been nursing patients and they may have been critically unwell. Or you were really concerned, you didn't really know what was happening, or there were sort of investigations going on or whatever. And I used to think, I mean, all nurses do this, but I used to really think about and worry, and I used to find myself getting going back down to the ward, even if I wasn't on a shift, you know, and kind of checking in and what's going on. And, you know, because you wanted to know, you know, obviously I was concerned, obviously, you know, being a nurse, that's, you know, caring is what it's all about, isn't it? So I think I had to learn to shut off is probably the wrong word, but I had to learn to kind of put boundaries around that, in the sense of, you know, I'm not a shift on anymore. I'm a student nurse, I'm a learner, and actually you hand over to another shift of nurses, and they then work with that patient, with that family, and it's actually not for me to be worrying about. When I'm next on shift, I'll find out what happened and then I'll pick up from there, sort of thing. So for me, it was probably figuring out in my head how to kind of compartmentalize or put sort of boundaries around it. Don't know if that makes sense.
Yeah, no, it does, definitely. And what's your favorite part of being a children's nurse, or what was when you were on ward or in community?
Yeah. Well, as I said at the beginning, I think I said at the beginning, I've loved every role I've had. And I think just being that trusted professional, that trusted person, and working with a child or young person is just so special. To be able to advocate their wishes, to support them to figure things out, to support them to make decisions, and to be there to listen, and just to be by their side, really, and facilitate their voice. In every role that I've had, even in this role, you know, I still do that, because I'm still, you know, I'm now supporting educators to make sure that they're training our nurses of the future as they should be. And they've got to learn that stuff. So I think for me, that's such a privilege. It's such an honor to be able to do that, to sit with a child or sit with a family and really help them in that way. So for me, it's probably that, that thing.
What does a typical day look like as a children's nurse to you?
Obviously, as a specialist community public health nurse in school nursing, I was a children's nurse first and foremost before I moved into that role and did additional training. You don't actually have to be a children's nurse to do that training. You could be an adult nurse or a midwife. But I very much use my children's nursing skills in that role, as well as my additional specialist community public health nurse. And I would always argue, if I have discussions with, not argue, that's the wrong word, discussions, if I had discussions with people about school nursing, for example, working in that arena in the community, I always think it's a great benefit if you've already done your children's nursing qualification, because you've learned so much about what it means to work with children and their development and, you know, their health. And, you know, it's very specific, you know, it's nursing children isn't the same. It's not like nursing mini adults. I think some people think it's, you know, it's the same, it's just they're smaller. It absolutely isn't, you know. So in the community space, as a school nurse, but children's nurse as well, a day-to-day would be, it'd be all sorts of things going on. So you might do visits in a school, doing a drop-in clinic. So you might have an hour or two where you've got an open door, where children can just come in and just tell you about stuff that's going on in their life, whether that's relationships, whether that's problems with their parents, whether that's they're concerned about their health, their weight, maybe that they've started to self-harm, could be all sorts of things really in that space. And sort of actively listening to the child or young person, trying to sort of reflect back what they're telling you, and engage them to think about things they could do to support themselves, signposting them to other services. Sometimes you'd have to make referrals, obviously depending on you know what the child would be talking, young person would be talking to you about. You could have set up one-to-one, so specific appointments with children or young people that you'd already started kind of like a some work. So you know, it's kind of like 6. Quite often you'd kind of assess a child, and or a young person. It might be from a referral from a teacher or a referral from a parent, or it could be, say, like a drop-in clinic, like I just explained. And actually you sort of think, right, actually we're doing a set piece of work together. Let's work on this thing together, whether that's self-esteem or whatever it may be. 6 sessions. So you could be going in and doing some one-to-one work around protective behaviors or anything, you know, anything really one-to-one. It could be doing an enuresis clinic. So that would be working with children, young people who are still bedwetting, so nighttime wetting, and working with them to sort of figure out the reasons why that's happening, doing an assessment, and then either prescribing medication or coming up with some things that you think they could do to support them to stop doing that. It could be immunisation, so it could be going into a school and doing all the HPV vaccinations, for example, for cervical cancer for girls or young ladies, or that sort of thing. So any sort of school age immunisations. It could be standing in a classroom and doing a session around what a healthy relationship looks like. It could be doing a session around sexually transmitted infections, or how to use a condom, or that sort of thing. Or it could be to younger children about healthy eating and what that looks like and how to look after your body. What else in that kind of community space? Safeguarding, so going to child protection conferences, so you might have seen the child before the conference, done a bit of a health assessment, what their health needs if they have any, and then presenting at the conference the kind of the health needs, well-being needs for the child, and then working with professionals to support those needs. Oh gosh, what else? I'm sure there's lots of other things. What else could it be? Oh, just trying to think. Those are probably some key examples probably in that space.
It definitely seems like it's setting them up for a better future, is what that's all about, really giving them the building blocks, isn't it?
Yeah, absolutely, absolutely. That school nursing is really about creating sort of the best start, I suppose. Getting it right at the beginning if we can, to support children to be able to support themselves, and to also understand how to keep themselves healthy, and helping them to support, if they do have health needs, how they can support those needs themselves, and also access obviously professional support, because we all need professional support sometimes in our lives to help us with things. So yeah, absolutely, it's that kind of prevention space as well as promotion of health, as well as protection against disease and illness and those sorts of things.
Yeah. And do you have a personal mantra or philosophy?
Do I have a So my current kind of philosophy or personal mantra is very much in the education space, because that's where I work. So as I said towards the beginning, because my role is quite strategic now, and it's supporting other academics to ensure that their programs are delivered as they should be, or as a sort of higher quality as they should be. For me, my kind of personal mantra, and the thing I come back to all the time, is high quality education for high quality care. When people ask me what I do for a job, my first and foremost, I will say nurse, and then they say, where do you work? Which hospital? And then I kind of go, oh no, I don't work in a hospital. And then I go through the whole kind of, well, actually what I do is this, this and this. But my focus has always been, and always will be, no matter what role I'm in, on the care quality, the experiences that patients, children, young people, families get out there, and whichever service that they're accessing. So for me, currently, my personal mantra is, we need to get this education right. It needs to be high quality, so that the students that we're training, we're supporting, we're educating, when they get out there in the community, in the acute services, wherever they're working, that they're delivering high quality care.
Yeah. That's a great philosophy. And what 3 words do you think children that you've helped would describe you as?
I think they call me a safe person. So somebody that they know that they can say anything that they need to say, and that I'm a safe person to say it to. I think they would also say I'm a good listener or advocate for their rights and their needs. That's 2. Trying to think of a 3rd one. Fun, maybe. You have to try and always make it fun when you're working with children. Of course, there's a time and a place where it might not be, for obvious reasons. But as much as possible, whether you're working with an acutely ill child, or you're trying to support a child to understand how to look after themselves and keep themselves healthy, trying to make things as fun as possible, according to obviously the age and development of the child, using toys, using, you know, I don't know, pictures, drawing, using Lego, you know, whatever you can use, try and make it fun appropriately. So, and I've always been, I think, quite good at that. So that's probably the third one I would put.
And what qualities do you think every children's nurse should have?
Oh, loads. Gosh, so I think you need to be a really good communicator, particularly an active listener, because children don't necessarily tell you verbally what their needs are. So you need to be really good at figuring out what their needs are, what they're trying to say, without them necessarily telling you. So that means you need really good communication skills, because you need to really sort of be able to observe that and use all your senses. Compassionate goes with absolutely, you've got to be compassionate and empathetic to their needs. Communication, compassionate. What else? I think being trustworthy is really important. You have to be trustworthy. I think understanding kind of comes really probably with the communication and being empathetic and compassionate. There's lots of practical kind of skills and knowledge you need, obviously, to be a nurse. So you need to be able to understand bodies and minds. You need to understand the psychology behind things, and you know, and all those sorts of things. So there's kind of that practical, I suppose, knowledge and skills and behaviours that you learn at university, which of course would take me all day to go through. But those are probably the key things. I'm sure I could come up with more if I think about it, but
And you probably get asked this quite a lot in your teaching side of things. If you could give advice to somebody wanting to become a children's nurse, what would you tell them?
Really good question. So my advice would be to try and speak to as many people as you know who've had a lived experience as a patient, if you can. It's not always an easy thing to do, particularly if they've been a child patient, because obviously it's really important you understand what that is. Talking to people that are nurses, obviously. Try to get some kind of experience in healthcare if you can. It doesn't necessarily have to be with nurses, because that's not always necessarily easy, but whether you can become a volunteer on a ward, or whether you can get some kind of work experience in some way. Doing a health and social care course, either at BTEC or doing biology, psychology, those sorts of subjects at A level are really useful. What else? I think, you know, reading, so accessing, it's really tricky, because, you know, what you see out there and what you read and what you hear in the news isn't necessarily 100% the real world of nursing. And I think, you know, sometimes we get a bit of a bad press, but I think nurses are one of the most, if not the most trusted professional when you look at the list of professions. But I think reading as much as you can around the NHS website, for example, is a really good place. It's kind of an obvious place, isn't it? There is a NHS careers website. I always advise people to have a little look. But accessing, you know, open articles, you know, things from like the Nursing Times or Nursing Standard, which are nursing journals, but they're easy to read nursing journals and have quite a lot of open access content, which can be quite useful to read and sort of understand. And then there's other websites, like, for example, NICE Guidelines, which is it's all the guidelines for practice, not just for nursing, but across all healthcare professionals. But it's quite an interesting website to go and have a little look, because it talks about how to assess patients and treat patients, and you can learn about different conditions and that sort of thing. And other websites, you know, just sort of looking through. I wouldn't list them all because I could be here forever, but yeah, those are probably the key things. Sort of understanding the profession, but also understanding what it's like to be a patient, I think, is really important.
Yeah, I think that's fantastic advice. What are the biggest challenges that nurses are facing at the moment?
So biggest challenges for nurses. So there's lots of challenges out there, and for people that are watching this video, whether you know about nursing, whether you don't, you'll know some of these challenges just by watching the news or reading the newspaper. So one of the things, of course, is just the issues around NHS funding. So we need much more funding. If we can have more funding, then we can hopefully have more nurses, but it's not quite as easy as that, because actually it's difficult to recruit nurses currently. So we currently have a recruiting, not crisis is the wrong word, but across the UK, we are down on numbers in terms of recruiting for nurses, student nurses. That is a national picture. So trying to get people into the profession is difficult, and I think that's because of what people see. They, on the news, they're watching about waiting lists, they're watching about there's not enough nurses. Nurses are not necessarily always treated the best by patients, and there's lots of reasons for that: frustration and their own difficulties and anxieties and fear and so on. So yeah, underfunding, lack of enough of us. It's not just about getting into nursing, but there is an issue with retaining nurses, and that's the other issue as to why there's not enough nurses, and a lot of that is to do with the fact that we don't, because of the funding issue. So that issue around, we don't necessarily have all the resources we need in practice, we don't necessarily have the well-being services we need as nurses, because it's it's a hard job, and we need support to be able to do that job. So that's hard. And then of course we've got more and more complex patients, and we have an aging population. Now that doesn't really affect children's nursing, because we're nursing between the ages of 0 to 19 or up to 24 if there's additional needs or complex needs or special educational needs. But it's a resourcing issue of nursing full stop, which of course has effect across the piece. So, but we are nursing children with more complex needs, because medical research and nursing research has moved on so much, and we understand more and more now about how to look after patients and look after people's conditions, where the reality is that we're keeping people alive for longer, and we're keeping them alive with more conditions than they ever had before, which is fabulous. But of course that does have resourcing issues for the NHS. So so there's a number of things really, and then people will always go down the pay route. We need to be paid more money, and that's another issue why nurses aren't retained as much as we'd like to be. You could argue that what is a decent wage for what we do is really hard to pinpoint, I think, personally, but I don't think any nurse would disagree that nurses would like to be paid a bit more.
Yeah, I think that's great. And what's the most important thing that nursing has taught you?
Oh, what's the most important thing that nursing has taught me? I think, as well as the obvious thing of obviously the importance of health and well-being and what that means for children to be able to engage in the rest of their life, that every child's experience is unique. Everybody, you might think you know what somebody is going through, a child or a young person or a family, their parents, etc., might be going through, because you've nursed that condition before, or you've nursed a girl before, or a boy, or a transgender, or whatever it may be. But actually everybody's experience is completely unique. And to never make assumptions, and to always, I suppose, treat everybody in that unique way, if that makes sense, and to not make assumptions, probably.
And looking to the future, what do you think is most important to focus on in children's nursing?
Oh, well, for me, I think probably because I moved into that more sort of public health space and working in the community, for me, it's got to be that preventative stuff. If we can support children and their families, their parents, to understand what it means to be healthy and how to stay healthy, then we can prevent so many other things in terms of health and well-being. If we can get parenting right, if we can get health literacy right, then we can prevent illness and injury and other such things. I think one of the biggest things we need to work on, and this isn't just across children's nursing, this is anybody probably that works with children, is around the kind of the disparities in health. So in the sense of not every child or young person gets the same experience in regards to their health, and that's because of their upbringing, it's because of the family they live, it depends on their geography, where they're based in the country, it depends on their access to services, it depends on what school they go to, and actually we need to get that right so that every child and young person has, you know, the same, and I mean that in the sense of that equity across the piece. You know, the reality is that, you know, depending on where you live, what family you're part of, that affects your health and your well-being. One of the biggest things we need to work on at the moment is child poverty, and it's massive. And I think if we can sort of help that, I mean, that's such a big thing, and children's nurses do have a part in that. Yeah. So those are kind of the key things, I think.
It's really making sure that everyone has that base standard level of living, isn't it?
Yeah, absolutely. Yeah. We're all humans at the end of the day. We all deserve the same, don't we?
And the big question is, would you encourage other people to take up children's nursing?
Yes, absolutely. Without doubt. I think if you have a passion for children, if you have a passion for childhood, and you're interested in health and well-being, then, and you love working with children, and you know, sounds a bit of a silly thing to say, and I probably should have said it earlier, but you do need to have kind of a natural knack now with children, if that makes sense. I don't know what that natural knack is, but like people who meet me for the first time and I say I'm a nurse, they automatically will say, oh, you must be a children's nurse. And I think that's something to do with my persona, the way I come across, the way I communicate. So I think if you have a natural knack with children as well, then absolutely, I think, yeah, you can't go wrong.
Yeah. Brilliant. Well, thank you so much for talking to me today and telling me about your incredible experiences.
You've been very, 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 very welcome. It's been a pleasure.
Thank you.
Thank you so much for watching our video. I've been Georgina with the Association of British Paediatric Nurses. If you enjoyed our video, please give us a like and subscribe to our YouTube channel. And if you have a question you'd like to ask a paediatric nurse, pop it in the comments below and we'll see if we can ask it in one of our videos. Bye!